There is a just mounting evidence as to just how big of a screw up this is. First of all, Trump is refusing to use the Defense Production Act, which he already signed, to ramp up production of things like ventilators, things like masks and whatnot. And this basically means that when the government orders something from your company, it comes before private production of other things. And I mean, I can imagine he doesn't want to do it because some of his business friends were like, nah, that's going to cost us money. And that's what's going on. He says, we're a country not based on nationalizing our business. Call a person over in Venezuela. And he's like, but they're doing it already. We don't need to compel them to do it. Here's a story of, and we have right now, hospitals who are cash poor can't afford new medical devices, imports of medical supplies. And look, we were talking about this on this show over a month ago, I think, at this point, right? When we were saying like the CDC was starting to make lists about drugs that wouldn't be available. And I was just talking about, my daughter saying that Depop, there were shipments being delayed and some of those Indiegogo, tech stuff. I mean, it was obvious that we were going to be facing this. And the idea that there was nobody in the, look, I can understand, sometime in January, maybe early February, you're not talking about the virus. You don't want people to panic, but you're already gearing up for these things. You're already making contingencies. You're already developing plans. I mean, I can understand why you might be hesitant to tell the public because you don't want them panicking in the event that this turns out to be nothing, but we want to make sure that this is, going to be okay. There were, apparently, not only did the Trump administration eliminate an American public health position in Beijing intended to help detect disease outbreaks in China. It's according to Reuters. The American disease expert, a medical epidemiologist embedded in China's disease control agency, left her post in July. I want everybody to sort of imagine, just like fully grasp what went on here. 2 years ago, they eliminate the primary and chief individual and his sort of cadre of lieutenants who coordinates the interagency stuff in the event of a pandemic and sits on the National Security Council, so can brief other members of the government and say, hey, we've got a real disaster coming down the pike. And then there's just these series of other firings of individuals throughout the government. You could talk about bureaucracy is boring and scientists are eggheads and technocrats don't know what they're doing. But this stuff matters. And each little thing they did degraded the system more. Maybe one thing here, one thing there wouldn't have made a difference, but you never know which one of those things are going to be. So you eliminate the position. It's not even about a personnel thing. It's the existence of the position. A CDC person in China who is an epidemiologist, that's the person who sends back to CDC, there's a real problem here, a real problem here. That's how you get out ahead of these things. Then there were U.S. intelligence reports from January and February warning about a likely pandemic. This is George Bush looking at that presidential briefing thing in August of 2001 and saying, okay, I've seen it. Yeah, bin Laden poised to strike. You've covered your ass. The warnings from the U.S. intelligence agencies, here it is. U.S. intelligence agencies were issuing ominous classified warnings in January and February about the global danger posed by the coronavirus, while President Trump and lawmakers played down the threat and failed to take action that may have slowed the spread of the pathogen. The warnings from U.S. intelligence agencies increased in volume toward the end of January and early February, said officials familiar with reports. By then, a majority of the intelligence reporting included in daily briefing papers and digests from the Office of the Director of National Intelligence. This is a Trump-appointed person. And the CIA was about COVID-19, said officials who've read the reports. You know that they heard the warnings, at least some of them, because that's when Richard Burr went out and sold his stocks for Jesus. Come on, man. This is my favorite graph of this. So inside the White House, Trump's advisors struggled to get him to take the virus seriously. Alex Azar, the head of the Department of Health and Human Services, couldn't get through to Trump to speak with him about the virus until January 18th. This is according to two senior administration officials. When he reached Trump by phone, the president interjected to ask about vaping and when flavored vaping products would be back on the market. I'm going to read this again. When Alex Azar finally got through to the president to talk to him about the coronavirus problem, the president interjected to ask about vaping and when flavored vaping products would be back on the market. We're going to see a lot of ads go up about this. Listen to this. On January 27th, this is now 10 days later, almost 9 days later, White House aides huddled with then acting Chief of Staff Mick Mulvaney in his office. Oh, incidentally, they got rid of the Chief of Staff in the middle of this. I'm not saying he would have been any better or any worse, frankly, but he was trying to get senior officials to pay more attention to the virus, according to people briefed on the meeting. This is Mick Mulvaney. Joe Grogan, the head of the White House Domestic Policy Council, argued, you ready for this? That the administration needed to take the virus seriously or it could cost the president re-election. Not like, or it could kill hundreds of thousands, if not millions of Americans. Not, or it's going to immiserate millions upon millions of people. It's going to destroy our economy. It's going to keep kids out of schools for who knows how long. But it could also inhibit your chances of being reelected. So we really should look at this. Huh? What? I'm going with ignore it and it will go away strategy. That's the strategy. That's what worked with Tiffany. So that's the way I got her out of my life. Just ignored her and then she was just gone. Meanwhile, the White House, according to the Daily Beast, the one thing they are doing, they are coordinating across agencies to launch a communications plan accusing Beijing of orchestrating a cover-up and creating the global pandemic. So, you know, it's the blame game. We're just going to blame China, and that'll be okay. Maybe we could start a war with them. Here is Donald Trump. After saying that hospital workers can sanitize and reuse masks, because he's in business. He knows you don't want waste. Somebody has manhandled that coleslaw at a restaurant. If it still looks good, you serve it to the next customer. Oh, that brake mechanism has failed. How much is it to replace it? Ooh, let's wait and deal with the lawsuits. We've got too many in our production flow right now to hold back. Here is Donald Trump explaining why he's not using the Defense Production Act, which would allow him to say to a whole host of manufacturers, hey, job number one is going to be producing X, Y, or Z. We need ventilators. You're turning your machines on. They're not going to be making vacuum cleaners anymore. They're going to be making ventilators.
Your Defense Production Act power.
Sorry. You're fulfilling private. I mean, there's a reason why the Italians were so pissed about those 500,000 tests going to this country, because they're like, we need them. And some private company got basically bribed to sell them to the United States because Trump was so desperate to have any tests in this country. Here's Trump explaining how, the market, the invisible hand will take care of it.
And on your Defense Production Act power, one of the features of that is that the federal government would be able to control the output, whether it's masks or ventilators, right, get it to the most areas of need, and control the pricing to keep it at a market level so it's not price gouging. One of the things we're hearing from governors, they can't find supplies and prices have gone up. So you've talked about the act, sir, but you have not yet compelled any companies. Why not?
Because we have so many companies making so many products, every product that you mentioned, plus ventilators and everything else. We have car companies without having to use the act. If we don't have to use specifically, we have the act to use in case we need it. But we have so many things being made right now by so many, they've just stepped up. In fact, Mike Pence and I were discussing it before. We've never seen anything like it, where they are volunteering. We want to make masks, like Hanes. I brought that up as an example. General Motors, I bring that up as another.
They go on the
Ford.
Open market, sir, right?
They're going to go on the open market. We want them on the open market from the standpoint of pricing, because otherwise it's going to be, we could be very unfairly
direct them to the places in
pause it for 1 second. Wait a second. Wait, what did he mumble there? We want them on the open market from a standpoint of pricing, because otherwise it's going to be unfair. Unfair? What? It's going to be what? They got to be able to charge $90 a mask. Otherwise, it's going to be unfair. They're already taking a hit there. Some of these guys may go out with may go without their bonuses. We're not going to. It's not fair. It's not fair. Continue.
As an example, General Motors, I bring that up as another.
They go on the
Ford.
Open market, sir, right?
They're going to go on the open market. We want them on the open market from the standpoint of pricing, because otherwise it's going to be, we could be very unfairly
direct them to the places in greatest need.
We are directing states, and sometimes we'll be competing against states, which I don't want, and we'll drop out of the bidding. We want the states to go first. And what we're doing is we're helping states. That's what we want to do. Same thing with the testing.
Pause it. I'm sorry, folks. The bidding? There's a bidding war? The states are engaging in a bidding war to get products because we don't want to be unfair mumble to these companies. A bidding war. The relief that is coming for medical workers is like an eBay auction. You could do it. You could buy it now, but that's up here. Maybe you could get it somewhere down here. And just to be fair, we're not going to bid against the different states. So that you got that going for you.
What we're doing is we're helping states. That's what we want to do. Same thing with the testing. We're helping states. We're helping states get to where they want. And we've made tremendous progress in every aspect of
This
it.
happens for a governor who needs equipment today.
Well, it's happening fast right now, and the governors are out there trying to get, and if they are competing with us, we immediately drop out, please.
Unbelievable. Unbelievable. You know, our trajectory, if you look at Italy, our trajectory is leaving them in the dust in terms of new infections. And that is because there are disparate responses to this state by state. That is because there have been initial responses by the federal government, by Donald Trump, by right-wing media has basically said, don't worry about it. This is a hoax. And man, like they're going to prolong this with this stuff, and they're going to make it just so much more severe. The idea that here it is. Look, we are the red there. And we, about 6 or 7 days ago, we were basically on track with Italy. Maybe about 8 days ago, we were basically on track with Italy. And then all of a sudden, we just took a hard left turn. And on a graph like this, you don't want to do that. That means that you're going straight up. You're going way up. We're over a 33% increase. We are over where China was these many days out. And I got news for you. I think that is going to be, I think by the time that we get to another 5 or 10 days, and that curve, we're not flattening the curve. Let's put it this way. We're getting rid of curve. There is no curve that way. It is now actually like going backwards. I don't know geometry enough to concave or convex, but whatever the one that you don't want is, that's the one that we're getting.
We need to start the curve.
Exactly.
America first.
We've been going like go back down here, right in between here, between like day 7 and 10 is where basically we lost the thread. Maybe day 12 and 10, right there. Yeah, right in there is where it really went wrong. Day 10, our response we could have kept it. And we didn't recover. And you could see like the UK, right? The UK, right at that time, right there, they had a little bit of that, and then they turned it to the right. The response at the beginning dictates how this is going to go. And we blew it. We blew it.
We also have another motive for Trump not wanting tests.
Let's see this one.
Or I just meant like they want to keep these numbers artificially deflated.
Well, the point is that you can have you can deflate the numbers, but really the thing to look at, not to get too morbid here, but this is where we're at, is you look at the deaths. The deaths, it tends to take. My understanding is like 3 weeks essentially. Takes you average 4 or 5, maybe 5 or 6 days to exhibit symptoms. It takes another 7 days to get ill enough that you need to get into the hospital. And the average for days of people who do die to die is another 7 days. So we will not have a sense that we have, because we don't have enough testing to establish that the number of cases is telling us anything. But deaths, you can actually measure. Deaths from coronavirus are much easier to measure. And my understanding is that the way to assess whether we've got any type of, we're starting to see any impact from social distancing or, across the board, is to look 3 weeks out from when people started. So in the case of, let's say, New York City, we're 2 weeks away, and the next 2 weeks are going to be ugly. They're going to be ugly in terms of fatalities in New York City. Other states and cities, I'm sure some are going through a similar thing. The density of New York, I think, is really, why this thing is, we're going to be first hit in the biggest way. Obviously, some isolated communities, but what we're hoping to see is sometime around April 7th or 8th, we have a couple of days, and maybe 3 days in a row is when you really have a real sense of it. 3 days in a row where the deaths are not multiplying at the same rate that they were before. I mean, I think people are anticipating a doubling of deaths from like now through that period of time. And then you want 3 days in a row where the deaths do not double, to give you a sense that the curve is starting to bend a little bit, that the things that you have put in place are starting to help.